So, started correcting the letter. Okay, write a letter. Discharge plan. So, discharge letter. Okay. So, to Boris Mac, oncologist, Lincoln Hospital, Butterfly Road, land in 6675, United Kingdom. Okay. Mr. To Boris Mac. Boris Mac. Boris Mac. Okay. Boris Mac. Boris Mac. Boris Mac. Boris Mac. Oncologist. Lincoln Hospital, spelling mistake. Lincoln, L silent. Lincoln, L silent. Oh. In the case notes only is problem. I don't know who prepared this case notes, but in the space only, Lincoln, Lincoln, Lincoln Hospital. H also should be capital letter. Okay, fine. It should be Lincoln. Case notes only mistake is there. Lincoln, Lincoln. Okay, hospital. Spelling mistake. Okay. Lincoln Hospital. Butterfly Road. Butterfly F should go down a little. This looks like capital letter. Land in 6675, United Kingdom. Okay. Right. United Kingdom, this is land name 6675, United Kingdom down. Okay. The 6675 you can put here. Okay, no problem. 14 May 2022. Dear Dr. Mac. Dear Dr. Mac. So if it is Dr. Mac here, then what about here? Dr. Boris Mac should be there, no? Okay. Dr. Boris Mac should be there. Definitely then. So oncologist. 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 Right? So doctor should be there also. Then why there you did not put? So that is how you'll identify things. Okay. Regarding Mrs. Boris, not Boris, it's Boris. Boris, that means you have problem with spellings. Boris, Boris Johnson. It's not Boris, it is Boris. Be careful when you're taking the names of the people. Boris. 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 Aged 44, right. Mrs. Boris Johnson, who is suspected to have endometrial cancer. So, this is correct sentence. But Ansala, I want to ask you one thing. Can you unmute?
Yes, sir.
So, are you happy with this or do you want improvement for this?
Yes, sir.
So, Miss Boris Johnson, whose signs and symptoms are suggestive of endometrial cancer, or whose signs suggest endometrial cancer. So, you can write like that one.
Okay, sir.
So, you can write two ways. Number one, who has, okay, signs and symptoms suggestive of, okay, endometrial cancer, that you can say, or else you can say whose signs and symptoms suggest, like that you can say. These two, anyone you can say. Endometrial cancer. What you have written is correct only. There is no problem with that. This is correct. This is 100% correct. Who is suspected to have endometrial cancer? This is correct. but these are better styles. Requires further evaluation and appropriate management. Say appropriate management instead of its management. Say appropriate management. Appropriate management at your service following the discharge today. Don't use a her, he, she. Avoid those things. Following the discharge today, the better. Don't use personal pronouns because this is not a personal letter. On 12 May 2022, Mrs. Johnson presented to hospital with severe vaginal bleeding, comma, after comma, full stop, comma immediately, no space. On 12 May 2022, Mrs. Johnson presented to hospital with severe vaginal bleeding, comma, weight loss and pain on the legs or in the legs? Pain in the legs and back. Okay. As well as during weight loss and pain in the legs and back, as well as during urination. Pain in the legs and back. Okay, and pain in the legs and back. As well as during pain. This is little confusing. Pain in the legs and back. Okay. Pain in the legs and back. As well as so pain, better to use and, because as well as means equal things you have to join. Okay, this is an activity and this is the name of a body part. You cannot join these two things here. Pain in the legs and back, okay. But as well as, okay. So that you have to change. Okay, and during urination, you can see. In addition, she has pelvic pain, loss of appetite, tiredness, and inability to do. Instead of do, you can say perform. Better word. Inability to perform. Better word is perform. Perform activities of daily living. Daily activities. Activities of daily living will be better. A series of investigations were performed for her, which revealed increased white blood count. Investigations, increased blood count. What do you mean here? A series of investigations were performed for her, which revealed increased white blood. How can, okay, which revealed increased, okay, increased white blood count. Okay, there is a meaning. Okay. So, which revealed, spelling mistake is there here, number one. Revealed, R-E-V-E-A-L-E-D. Revealed. Revealed increased white blood count, decreased hemoglobin level, and electrolyte imbalance, as well as abnormal. Why are you using too much as well as? Too many times you are using as well as. Avoid, this many times is not suggested. A series of investigations were performed for her. Why for her? Is it needed for her? For her only one patient is there. You are not doing for anybody else. A series of investigations which were performed revealed, which revealed, no, not here, this which is not here actually. Which were performed revealed. This which should come here. A series of investigations, comma, which were performed revealed. Like that you have to write. Comma, which were performed. Which were performed, revealed increased, now it is correct. Increased blood cell count, comma, why space before comma? People don't understand the importance of, not giving space, comma, no space. Decreased hemoglobin level and electrolyte imbalance. As well as abnormal growth of the cell. Okay. Constipation and bleeding from the bladder and rectum. Constipation is 1 and bleeding is 2. From the bladder and rectum have been reported. Not has. Very nice. You are writing very nicely, but you have to improve a lot. So have, 2 things are there. One is constipation and second one is bleeding. 2 things. Constipation and bleeding from the bladder and rectum have been reported. First one is constipation, bleeding from the bladder and rectum have been reported. 2 things have been reported. Today, she again presented to hospital due to fainting at home. Okay. Profound vaginal bleeding and breathing difficulties have been notified. See, have been, not has, have been notified. Same problem. More than 1, you have to say have. Profound vaginal bleeding is 1 and breathing difficulties are more. So 1 plus 1 plus more is more. Have been notified. Vital signs were recorded. Okay. Mrs. Johnson is living with her husband. Yeah. Mrs. Johnson is living with her husband and daughter. She has had irregular menstruation since April 2022. Very good. After full stop, no space before full stop. After full stop, there should be space. Okay. Additionally, comma, she has polycystic ovarian syndrome. Polycystic is 1 word. Why space? Polycystic is 1 word. Okay. Polycystic is 1 word. Polycystic. Polycystic is 1 word. Medical specialized. Polycystic is 1 word. Why did you write 2 words? Polycystic is 1 word without space. Ovarian syndrome, comma. After comma, space is needed. Before comma, space is not. Endometrial hyperplasia and excessive irregular growth. Hyperthyroidism has been reported. Very good. Therefore, intake of thyroxine, comma, no space before comma, space after comma, 0.5 mg tablet has been prescribed, not informed. Okay. So she took on her own or what? Informed. Prescribed. Okay. Yeah. So, okay, has been, okay, not informed. hyperthyroidism has been efficiently managed with thyroxine 0.5 mg. Like that you can say. Hyperthyroidism has been reported. So instead of that one, you can say thyroidism has been effectively managed with thyroxine 0.5 mg tablet. Like that you can say. Okay. So hyperthyroidism has been effectively managed with, has been effectively managed with, like that you can say. Okay, hypothyroidism has been effectively managed with thyroxine. So you can say like that, no? 0.5 mg tablet. Okay, has been informed is not needed. She was allergic to nuts. She was allergic to nuts. Allergic